Teratology, the study of the effects on harmful agents on development. A teratogen is an agent that can cause abnormal development in a fetus. About 3 to 5% of all live-born babies are identified as having malformation at birth. Additionally, 6 to 7 of elementary school children have malformation that existed since birth. Many more babies will be born with malformation were it not for natural prenatal process that results in miscarriage or spontaneous abortion. It is estimated that 90% of some kinds of malformation end in spontaneous abortions, and that without this natural screening process, the observed incidence of congenital malformation would be 12% or even higher. The effect of teratogen depends on the genetic makeup of the organism exposed to it. A substance can be teratogen for one species and completely harmless for another. The timing of exposure also plays a crucial role. For the first 2 to 3 weeks after conception, the zygous fluids do not mix with those of the mother, making it relatively resistant to some teratogens. The likelihood and severity of abnormal development increases with the level of exposure to the harmful agent. One well-known type of teratogen is certain medications. A completely disastrous case is thalidomide, that was once sold as an over-the-counter aid for sleep and morning sickness. Unfortunately, it caused severe birth defects, including malformation of the eyes and ears, deformed internal organ, fused fingers and toes, and phocomelia, extremely shortened lips. Thalidomide interferes with the development of blood vessels, which is crucial during the early stage of fetal development. Between 10,000 and 20,000 babies were born with disabilities due to the use of thalidomide, and approximately 2,000 children died. How did that happen? Well, it seems that the studies published by Chemie Grünenthal, the company developing the drug, weren't very thorough. There was no placebo group, no clear indication of how long the treatment lasted, and none of the studies were double-blind. They also didn't measure how much thalidomide was in the blood or tissues of the patients taking it. Some people argue that animal experiments didn't show malformed offspring, so animal tests wouldn't have stopped thalidomide from being marketed. However, a closer look reveals that this was because most animals gave birth at night, and many species will cannibalize a baby born with deformities. So when technicians arrived in the morning, only healthy offspring were visible. When caesarean sections and nighttime monitoring were used, it was found that animals given thalidomide during a particular stage of pregnancy did give birth to babies with malformations. Another issue with some of the studies using pregnant animals was that the drug was dissolved in water or another solution for injection, rather than being given in tablet form. Many of these animals didn't produce malformed offspring, but it was later discovered that the active ingredients in thalidomide break down and become inactive in solution. The thalidomide scandal had a huge influence on the drug testing. Nevertheless, thalidomide was sadly not the only one drug teratogen. Diethylstilbestrol, or DES, was prescribed in the 1950s and early 1960s to help reduce the likelihood of miscarriage. However, it was later discovered that children of those who took DES have a higher chance of developing certain cancers, infertility, autoimmune conditions, and depression. Additionally, the grandchildren of those who took DES have a slightly higher risk of cancer and infertility. Another example is that two over-the-counter substances, aspirin and benzoic acid, which are harmless on their own, can cause harmful effects during pregnancy. Let's move to the illegal drugs. Heroin is a morphine opioid used medically to relieve pain and illegally as a recreational drug for the euphoria it induces. Heroin is usually injected in vein, but can also be smoked and inhaled. Babies from mothers who took heroin as they were pregnant experience neonatal abstinence syndrome. Neonatal abstinence syndrome is most caused by opioids taken during pregnancy, but it can also result from the use of antidepressants and barbiturates. Babies with neonatal abstinence syndrome often show symptoms like irritability, shaking, and digestive issues. In more severe cases, they might have a low birth weight, experience seizures, develop jaundice, or be at risk for sudden infant death syndrome. As these children grow, they may face developmental challenges, including delays in motor skills, behavior, learning, and speech development. Heroin addiction during pregnancy often comes with poor nutrition and inadequate health care. Nearly 75% of pregnant heroin users don't see a doctor. This can lead to medical issues like anemia, heart disease, hepatitis, tuberculosis, high blood pressure, and urinary infections in 40 to 50% of these women. They are also more likely to miscarry or give birth prematurely. To help break the heroin habit, expectant mothers might use methadone, a synthetic drug. However, methadone is also addictive and can lead to neonatal abstinence syndrome in newborns as well. Cocaine is a stimulant that affects the central nervous system. Using cocaine can increase alertness, create feelings of well-being and euphoria, boost energy and motor activity, and enhance feelings of competence and sexuality. Cocaine use during pregnancy can lead to several serious issues, including preterm birth and problems with the placenta, such as placental abruption, preeclampsia, and placental infraction. Babies exposed to cocaine during pregnancy are at a higher risk of being miscarried or stillborn. If they are born alive, they are more likely to be premature, undersized, or experience a slowed growth. These babies often have trouble regulating their alertness, emotional reaction, and sleep patterns, making them more challenging to care for. In the long term, children exposed to cocaine in the womb may face challenges like poorer language development, difficulties with learning and perceptual reasoning, behavioral problems, and negative effects on memory and executive functions. Cannabis. Cannabis has various mental and physical effects, which include euphoria, a later status of mind and sense of time, difficulty concentrating, impaired short-term memory, impaired body movement, balance and fine physiomotor control, relaxation, and an increase in appetite. Research indicates that heavy cannabis use during pregnancy can make newborns jittery and less responsive to visual stimuli. However, These negative effects are less likely if the mothers maintain good health practices. Although prenatal cannabis exposure doesn't seem to affect children's overall IQ, it does appear to impact other aspects of their intellectual functioning. Specifically, it can affect their executive functions, which includes cognitive abilities and behaviors that are essential to effortful, goal-oriented tasks. Nicotine creates a temporary feeling of well-being and relaxation. When nicotine enters the body, it triggers a surge of endorphins, which are chemicals that help relieve stress and pain and improve mood. Smoking during pregnancy can impair the placenta's ability to function properly, especially in terms of oxygen exchange. On average, babies born to mothers who smoke are smaller and at risk of premature delivery. Complications increases with the number of cigarettes smoked per day. Additionally, the risk of sudden infant death syndrome is higher in babies exposed to cigarette smoke before birth, with up to one-third of all sudden infant death syndrome deaths potentially linked to prenatal smoking. As these children grow, they are at high risk for social and behavioral problems. They may also perform poorly on measures of language and cognitive development. Now we are coming to the most commonly used drug in our society, alcohol. Drinking alcohol during pregnancy is the top non-genetic reason for intellectual disabilities in children, both in Canada and around the world. Fetal alcohol spectrum disorders are a group of conditions that can happen when a person is exposed to alcohol before birth. There is no known safe amount of alcohol during pregnancy. The risk of fetal alcohol spectrum disorders goes up with the amount, frequency, and duration of alcohol consumption during pregnancy. In North America, at least 1 in 100 births are affected by fetal alcohol spectrum disorder. Sometimes children with mild fetal alcohol spectrum disorder might not show obvious physical signs, but still face cognitive, attention, and learning challenges. Neurological issues and social difficulties can lead to children with fetal alcohol spectrum disorders being unfairly labeled as bad kids. They might be hard for parents to manage, be taken advantage of by other kids, or get involved in negative peer relationships. Children with fetal alcohol spectrum disorders often struggle with depression and anxiety and report a lower quality of life compared to their peers. This is Casey Moore. She was 17 years old at the moment when she told her story to BBC. At that time, she was living with her biological brother and sister. All of them have fetal alcohol spectrum disorders and their adoptive parents at their farm. Let me read her story. Hi, I'm Casey, and like my sister, I am living with fetal alcohol spectrum disorder. It doesn't really bother me because I always live with it and it is not going elsewhere. I can read, but this is hard. I don't know if I will get my driver's license because there is a lot to learn. I don't take the bus because the maps are too hard to figure out. My mom or dad will take me where I need to go. I am hoping to graduate from high school this year, but I'm not sure what I will do after that. I might go to college for baking, but that will mean living by myself, and this is scary to me. As you can see, in her life she will always depend on helpful others because of fetal alcohol spectrum disorder. Fetal alcohol syndrome is the most severe form of fetal alcohol spectrum disorders. Every 23rd heavy drinking woman gives birth to a child with fetal alcohol syndrome. In North America, 1 to 3 out of every 1,000 births are affected by fetal alcohol syndrome. Children with fetal alcohol syndrome often face growth delays, intellectual disabilities, and learning challenges. They may also have behavioral problems, being irritable, having trouble sleeping, and being difficult to feed as infants. As they grow, these children might struggle with attention, language, and motor skills. Adults with fetal alcohol syndrome often face mental health issues and job difficulties. They may also have legal troubles, and incarceration doesn't seem to help. Recognizing this, the Canadian Bar Association has called for alternatives to prison for those affected by fetal alcohol syndrome. This gentleman is called Hunter Sargent. He is 31 years old and he has fetal alcohol syndrome. He has no job and can't drive a car. He gets a monthly social security check because he is considered mentally disabled. Sargent says his math skills are limited to counting on his fingers, and he can't manage his own money. Hunter says he was an angry, sometimes violent child and prone to trouble. He needed constant supervision. He lives in a subsidized apartment and has a personal care attendant who provides help with day-to-day living, but Hunter says that help isn't always around. I gotta say, dealing with fetal alcohol syndrome as a kid was a lot easier because I could hand off my frustration to somebody else and they deal with it, Sargent says. Now, as an adult, my support has certain hours that they can work with me. But at night, if something were to arise, I have to constantly think of ways to diffuse myself from any negative or inappropriate behaviors or actions or thoughts. Sargent tries to live a normal life as best as he can. He knows his dream of one day becoming a police officer or psychologist will never be fulfilled. He'd like to one day handle his own affairs, but he is not sure if that will happen either. Let's move from one sad topic to another: maternal infectious diseases. Short-term infection during pregnancy can seriously affect the developing baby. Rubella can harm the baby's central nervous system, leading to blindness, deafness, and intellectual disabilities. It can also damage the heart, liver, and bones, depending on when the infection occurs. Cytomegalovirus can cause abnormal brain and head growth, encephalitis, blindness, deafness, and intellectual disabilities. Herpes simplex can lead to encephalitis, damage to the central nervous system, and eye problems. HIV causes AIDS. If untreated, 25% of babies born to mothers with HIV will get the virus and may die at a young age. Syphilis can cause damage to the central nervous system, deformities in the teeth and skeleton, and even death. Gonorrhea can result in premature birth, premature rupture of membranes, and spontaneous abortion. Additionally, 30% of fetuses may develop an eye infection that can lead to blindness if not treated. The fertilized egg must multiply into trillions of cells to form a fully developed fetus. By the ninth month of pregnancy, the baby and its support system will weigh between 11 to 16 kilos or 25 to 35 pounds, billions of the times the weight of the fertilized egg. Where does all this mess come from? The answer is simple, from the mother. Malnutrition is linked to high rates of spontaneous abortion, infant deaths, and congenital defects. Babies who are malnutrition before and after birth are more likely to experience delayed motor and social development. During World War II, many countries faced severe food shortages. This led to fewer conceptions, more miscarriages, stillbirths, and birth defects due to inadequate nutrition. The long-term effects on children depended largely on their environments after birth. Children who were malnourished as fetuses but received proper nutrition and stimulation as infants and children did not show long-term intellectual deficit. However, babies who were malnourished both before and after birth were more likely to have delayed motor and social development. They often became inattentive, unresponsive, and apathetic. Mother's psychological stage is another important factor that influences the baby. High levels of anxiety have been linked to newborn irritability, feeding and sleep problems during infancy, and behavioral issues at 4 years old. They are also associated with high chance on congenital physical abnormalities such as heart defects and cleft palate. Additionally, high levels of prenatal stress increase the likelihood of preterm birth, low birth weight, and complications during delivery. Here is an example of longitudinal study from Canada. In the winter of 1998, a severe ice storm hit eastern Canada. Many people, particularly those in rural areas, had to leave their homes or manage without power and, in some cases, water. This was an extremely stressful time for many residents. Researchers from McGill University and the University of Montreal interviewed expectant mothers who lived through the storm in the hardest hit areas. They found that many experienced high level of stress during this environmental disaster. Children born to these mothers were found to have a poorer intellectual and language abilities at ages 2 and 5.5. Traditionally, it's been believed that the best time for having children is between the ages of 20 and 34, with the ideal period being from 25 to 29. Because of this, there has been some concern about having children outside this range, whether it's men who are over 35 or older, or those who are still in their teens. I have come across some newer statistics from Canada, showing that the trend of women having children at older ages continues. While teen pregnancies still occur, they are becoming increasingly rare. Sadly, increased maternal age is linked to the higher likelihood of giving birth to a baby with Down syndrome. The father's age also plays a role, as the frequency of mutation in sperm increases with the age. One genetic disorder related to the father's age is achondroplasia, which causes bone deformities. Recent findings also suggest that the father's age may contribute to the risk of autistic disorders in children. Additionally, older mothers have been found to be more at risk for preterm birth, difficulties during delivery, and both infant and maternal mortality. Babies born to mothers in their teens are also at a higher than average risk for complications during pregnancy, preterm birth, and low birth weight. However, it's important to note that factors associated with teenage pregnancy, like smoking and doing illegal drugs, seems to be more significant than the mother's age itself. When these factors are controlled, the problems associated with teenage pregnancy are greatly reduced.